that position. But I just wanted to say to you that I've spent some time in politics and some time in multilateralism and some time in diplomacy, and I never thought I'd reach this stage in life where I didn't understand the way the world works. But I don't understand the way the world works. I don't understand how it's possible to sustain so much injustice. I've got to bring these remarks to an end, but I want to say to you, I was in Swaziland yesterday. I went out on one of those field visits, as it's called, and we made 4 stops. The first was to see 39 lovely orphan kids, all of them orphaned as a result of the death of parents from AIDS, ages 3, 4, 5, and 6, at what in Swaziland they call neighborhood care points, where the children get, if possible, 1 meal a day, and they have a little bit of learning if there's someone around to do it, and some social and psychological support from the neighbors and friends in the community. And they were all huddled together in a little room, their little faces buoyant, their little eyes shining with expectation because there were visitors. But there was also a kind of pallor of sadness, which is difficult to convey, because there's something inconsolable in the soul of a child when the anchor of life is yanked away so abruptly and so inexplicably, as is happening in country after country in southern Africa and in many other parts of the world, perhaps not as dramatically or in such numbers. But in Swaziland, you have the highest prevalence rate on the planet, and fully 10% of the entire population are now orphan children. And the second stop we made was to a child-headed household, 3 little kids who had suffered a terrible violation by virtue of their stepmother engaging in property grabbing. And after the parents died, the house was absolutely ransacked. They even took the children's notebooks and uniforms. It was staggering. And if it hadn't been for the organization of Women Living with AIDS stepping in and helping these kids, they had no food. They had absolutely nothing. And we asked them what we could do, and the little girl who was 13 buried her face in the dress of the woman who was leading our little foray, and wept and said that what she wanted was a pencil and a piece of paper, because she had an examination on Monday and she had nothing to write with and nothing to write on. And the impoverishment of the circumstances just so deeply offends human sensibility. And then we went to a home which was ostensibly run by a grandmother, but the grandmother had had a stroke and she was HIV positive. There were 4 kids in the home and they were looking after the grandmother. One of the kids, a little girl of 7, had been so badly burned in a dreadful fire that she'd lost her arm, and her poor face and figure was misshapen, and you could see the ostracism she was feeling and the sense of panic and confusion in the house, and they had nothing to eat. They had absolutely nothing to eat. I mean, this is a country where a monarch sends his wives to Dubai on a shopping trip, and little orphan kids, they have nothing to eat. And our last stop was at a care point itself, where there were 200 women gathered, sitting on the ground. It was raining, it was cold, and they were with their infant babes. And they listened respectfully to the speeches. And then you ask them, what is it they most want? And it's always food. Everyone is hungry. And for people on ARVs, it has to be nutritious food so that the body can absorb the antiretrovirals. And as we were leaving, they all lined up for a morsel of food in the rain and in the cold, 200 strong. And I thought to myself, it's such an indignity. It's a kind of madness that it's 2008, and there are still countries and peoples all over the world who are rendered thus dependent and vulnerable. And yet, I look out at those 200 women, and I know that if they had half a chance There would be cultural leaders, economic leaders, social leaders, political leaders amongst them. There's so much generosity of spirit and intelligence and sophistication at the grassroots that it's a kind of blemish on the soul that it should be allowed. So I say to you that as you're doing your magnificent work, and I honor it, I salute you for it, remember that in the broader ambit of human behavior at the top where decisions are made, people have yet to be convinced about social and human priorities. And as you do your work on the ground in such a conscientious and decent way, remember that you have to, in addition, engage those who are obdurate, those who are intractable, those who are passive and in denial. There is nothing more worthy in this world than the struggle for social justice and equality. And I know that struggle is writ large on the mandate of CARE. Thank you.